When I started working in Uganda, in the little clinics that I was visiting, at least one or two people a day were dying of AIDS. You see that, and it just changes your perspective. You say, maybe I can do something. We set up a lab to understand HIV treatment outcomes. Through that lab, we were preparing for the antiretroviral drugs that were used around the world to be utilized finally in sub-Saharan Africa, where it was needed the most. There's different strains that don't exist in North America that are circulating there. So we were able to provide testing and understanding of how well those drugs were working. And especially when those patients became resistant to the drug, we needed to identify that. It was a really daunting task because electricity wasn't stable. We had power outages all the time. And eventually we were able to manage, and we developed assays to be used in Africa for drug resistance testing. Those drug-resistant assays have now been used in at least 100,000 tests, probably in 100,000 patients in Uganda, and has now been adapted by the national program to do just as many tests or more. And that continually increases. It has changed the landscape. Through those programs, they staved off at least 20 million deaths. I do research not to treat a single person. I do research to hopefully rid the world of a disease. But you can't do it alone. You have to bring in pathogen researchers, immunologists, and they all have to be part of that grand experiment. All of us need to work towards solving it and pave the way for those discoveries.